Diagnosis of heart failure with normal ejection fraction where the EF is more than or equivalent to 50% is a very challenging problem. Most of these people will have some fluid logging in the lungs, because of which they suffer from breathlessness, and they approach a lung specialist because on their chest X-ray or the CT scan it can be found that there is increased fluid in the lungs. So they will be misinterpreted as lung infection, and certain antibiotics and bronchodilators will be given with a resultant some relief of the breathlessness. But they get a echocardiography done, the ejection fraction is normal, and because of the low knowledge about preserved ejection fraction amongst the doctors, this is a underdiagnosed problem. So how can we diagnose this problem? So we already understood that when the ejection fraction is normal, nobody will consider a heart failure. So in those patients we have to do some advanced echocardiographic modalities. Common amongst them, what we do in our routine practice are global longitudinal strain, E by E prime ratio, left atrial volume index, left ventricular hypertrophy. So those are some specialized parameters based upon which we on echocardiography we can suspect the presence of heart failure with preserved ejection fraction. There have been certain parameters or certain scoring patterns which have been established in the last 2 years, but even those scoring patterns also miss out 30% of the heart failure with preserved ejection fraction or diastolic heart failure patients. So that allows us to let us be aware who are the patients who are at a high risk of developing preserved ejection fraction. The first one being elderly people, age more than 60 years, women, those patients who never had a heart disease or a heart attack, no coronary artery disease, that is normal coronary arteries. Then the fourth is those patients who have got high blood pressure, patients who have got obesity, patients who have got long-standing diabetes, associated chronic kidney disease. These are the groups of people who can be afflicted with preserved ejection fraction. The advanced the age, the higher the chances of preserved ejection fraction heart failure problem. Now after doing this, if one wants to confirm the diagnosis of heart failure with preserved ejection fraction, there is only one gold standard test, that is the cardiac catheterization. One should have a very low threshold of getting a cardiac catheterization done, because once we do the cardiac catheterization, it will definitely differentiate whether the heart failure is the problem, that is the heart is the problem or the lung is the problem. If there are elevated pressures in the heart and the lung chambers, that indicates that the heart is the problem. So that is how we will be able to make the diagnosis and treat the patients in a better way.